Hello, everyone. Myself, Dr. Rahul Rane. I'm orthopedic surgeon specialized in spine and joint replacement surgeries. I'm associated with Hiranandani Hospital in Powai, Hiranandani, Nanavati Hospital, as well as Criticare Hospital and Raksha Hospital. I completed my master in orthopedics from Mumbai. Along with that, I have done advanced fellowship training in endoscopic spine surgery, which is keyhole, minimally invasive spine surgery from South Korea. And I have experience of 15 years in the field of orthopedic, spine surgery, and joint replacement surgery. As we are discussing today's topic mainly on the musculoskeletal system, I'll go point-wise along with a summary at the end. So let's start today's topic, the musculoskeletal health. So we can discuss today what's the importance of musculoskeletal health. As everyone is aware, our musculoskeletal system comprises of all our bones along with a musculoskeletal system, the muscles, tendons, and adjoining structures. It plays a very crucial, important role to keep everybody's health in good mobility dexterity, along with enhancing the ability to work actively and participate in our day-to-day activity. The good musculoskeletal health is crucial in maintaining economical, social, as well as functional independence in life course. Physical activity has a crucial role in reducing the risk of other non-communicable diseases, and it can only be achieved with adequate musculoskeletal health. Now, let's see the relationship between the painful musculoskeletal condition and reduced capacity to engage in physical activity. As we know, impaired musculoskeletal health can lead to acute and chronic pain, causing physical limitation, proceeding to loss of participant and withdrawal from usual social activity as well as community activity and occupational activity, which further decreases the quality of life, physical well-being, as well as the mental well-being of a person. Impaired musculoskeletal health can lead to substantial personal, community, as well as social consequences. And this is mainly associated with the older people. There is a very strong relationship between the painful musculoskeletal condition, lack of physical activity, and resulting in the functional decline and loss of well-being, loss of independence, as well as depressive symptoms. And all these things has been described in various epidemiological studies. An individual with arthritis and some musculoskeletal disorder is surely lesser active than the individual without arthritis. Thus, a lack of regular physical activity emerges as the most prevalent risk factor associated with further decline in the day-to-day activity. Most importantly, the impaired musculoskeletal health causing the reduced physical capability like grip strength, walking speed, chair rising, standing balance has been frequently linked to increased mortality. Thus, weak musculoskeletal health is a key component of frailty. Now we can see what is the impact of impaired musculoskeletal health. The impaired musculoskeletal health is now recognized globally with an increase in mortality and morbidity related to it. A good musculoskeletal health is crucial in maintaining an active, productive, and prolonged working life. With an increase in global retirement age, maintaining good musculoskeletal health will become increasingly important for older workers, as many occupant and work-related activity are associated with musculoskeletal disorder, like low back pain and shoulder disorders. Thus, it is important to identify and implement effective intervention for people with musculoskeletal condition to remain productive at work. High-income countries observe musculoskeletal condition to be one of the major causes of work loss and early retirement and lost retirement wealth. While developing countries sees musculoskeletal conditions to have a major impact on livelihood. Thus, reduced musculoskeletal health result in reduced productivity and economic loss in societies at all the levels. Since the musculoskeletal conditions are chronic, painful associated with the disability, social disarrangement, frequently causes mental and physical impairment, such as depression, anxiety, as well as other comorbidities. The physical and mental aspect of quality related to life is very much important and known to be as greatly impacted in person with multiple comorbidities. And these unfortunately lead to further impairment and further leading to a more socioeconomic impact on individual, as well as that compared this collective effect causes that entire impairment to entire society. We can see now what is the burden of disease related to the musculoskeletal conditions on our society. As a non-communicable diseases now account for most of the global burden of diseases, with musculoskeletal being the leading contributor. As we know, arthritis is a major factor in the impairment as age-related issue. In developed countries, well recognized the transition of burden of a long-term disabling conditions, this arthritis condition. However, now low and middle economic countries are also demonstrating the enormous impact from the musculoskeletal condition, such as osteoporosis, arthritis, low back pain, driven by population of growth and aging. Since aging is the commonest risk factor for the musculoskeletal condition, and it is estimated by 2050, there will be 5 times rise in the people over age of 40 years living in developing countries as well. Additionally, the obesity is another further risk factor along with the aging. Aging along with obesity, which causes an increased weight on our knees, which leads to the arthritic condition. And these obesity, aging combinedly causes and multiple musculoskeletal conditions. And there is an hypothesized to which will rise dramatically of all these musculoskeletal problem in developing countries right now as compared to the developed countries. Furthermore, there is increased use of motor vehicles, not only reducing the physical activity, but also increasing the number of motor vehicle accidents and resulting in musculoskeletal traumas and other disorders. We can see what is the role of physical inactivity and sedentary behavior in the musculoskeletal health. Sustained and systemic urbanization in developed countries has led to increase in sedentary behavior among the people, particularly younger age group. The rapid growth of video games, social medias, use of WhatsApps, Facebook, Instagram, movie streaming, binge watching, all this Netflix and other issues. So as we were discussing, the sustained and systemic urbanization, which is leading to increase in sedentary lifestyle, along with excessive use of social media, Netflix, Instagram, Facebook, all these activity, which is making people bound to couch, making them more sedentary, has quite a tremendous effect on the musculoskeletal health. This lead to the reduced activity causes further weakening of our musculoskeletal system, which increases further diseases in musculoskeletal system. Sedentary habit causes increase in weight, weakness of our musculoskeletal system, and there is this surge of all musculoskeletal problem, this called starting from low back pain, shoulder pain, all joints problem, early osteopenia, reduced calcium. The surge in sedentary behavior, it not only a major risk factor for many chronic diseases, but it also recognized as substantial global economic burden. The increased physical activity and optimizing exercise are recommended by arthritis research societies as well as World Health Organization in an optimal way to improve the musculoskeletal health. Evidence shows that effect of sedentary lifestyle like desk job can be reduced by small amount of activity every day. A recent meta-analysis utilizing data of more than 1 million individuals concluded that 1 hour of moderate level activity daily can eliminate the risk of death associated with 8 hours of sitting. Thus, moderate level of physical activity remains a key requirement for healthy aging and maintaining musculoskeletal health. Sedentary behavior is a major contributor in obesity and type 2 diabetes. Likewise, obesity is also a major contributor in development and progression of osteoarthritis, with several epidemiological studies confirming a link between adiposity and joint degeneration. Evidence suggested that increase the level of physical activity will not only increase the musculoskeletal health, but also decreases the suffering from obesity related diseases such as diabetes and blood pressure. WHO recommendation on physical activity for healthy individual. Nearly 2 hours per week of moderate physical activity for approximately around 20 minutes a day of any kind of physical activity like brisk walking is recommended by WHO. These exercises elevate the heart rate and are known to be associated with lower lifetime risk of cardiovascular disease. Apart from rendering the musculoskeletal health benefit, improvement in cardiorespiratory fitness can be achieved by changing the sedentary behavior to achieve the low intensity of physical activity like walking, jogging, cycling. Exercise is now widely prescribed for the rehabilitation of musculoskeletal injuries, and it is used as a preventive measure as well. And it's been widely investigated with a guideline around the type, frequency, and duration of activity being considered. Focuses on evidence-based intervention for musculoskeletal condition that causes most disably adjusted life years. As low back pain, neck pain can be benefited by staying active and exercising regularly. Even in the sedentary lifestyle, if people adopt a habit of simply just getting up from their place every half an hour, 30 to 40 minutes, just for 30 seconds or 1 minute, can be benefited. It is observed that this has quite a good benefiting effect. So I was discussing on the evidence-based musculoskeletal conditions which causing effect on daily activity. As neck pain is quite common in sedentary lifestyle, the people with a desk job. So simply the activity modifying things like just standing for a 30-second or a minute for after 30 to 40 minutes of routine work, continuous desk job work, has quietly reduced almost 90 to 95% reduction of the neck pain and back pain. And this has been proven in studies. This reduces the incidence of fall balance and strength training and home hazard assessment. And participant in the fall prevention program and getting involved in activity like gardening, dancing, etc. Even osteoarthritis have been shown to be benefited from the activities and exercise that improve muscles and aerobic fitness, like walking, swimming, pilates, weight loss support, and all can render if required. Let's see a association between the physical exercise and healthy aging. We all are aware aging is inescapable. Aging is an evident factor, but we can make it easy, healthy with the help of exercise. We cannot avoid aging, but exercise renders a lot of benefit on the aging body, including reducing the manifestation of aging, especially the aging phenotype on the elderly. In recent studies, it is concluded that the physical activity plays a positive impact on the muscle mass and function of healthy subject, which almost more than 60 years and above, by improving muscle performance and increasing the ratio of type 1 and type 2 muscle fibers, increasing cross-sectional area of type 2 muscles fiber. And European Society of Clinical and Economical Aspect of Osteoporosis, Osteoarthritis, and Musculoskeletal Disease Task Force recommended higher protein intake in combination of physical exercise in postmenopausal women at risk of developing menopausal associated musculoskeletal diseases like osteoporosis. Physical exercise program improves strength and balance in the aging people more than 60 years and reduces a lot of risk of osteopenia as well as osteoporosis. Thus, having an active lifestyle from early age following recommendation from exercise is a beneficial for women as well as men. Women has a more tendency to develop osteopenia as well as osteoporosis postmenopausally, as there is sudden reduction of the hormone estrogen. Furthermore, the exercise and the mechanical loading as well as the positive impact has a major impact on the molecular level, cellular level, and tissue level. Like with aging, the potential cell proliferation and the number of stem progenitor cells, like decrease in the tendon loading, can induce an increase in tendon collagen and synthesis of increased tendon strength. Physical exercise and mechanical loading have also positive role in maintaining the cartilage and bone health as well as the joint health. Moderate exercise could enhance the quality of tissue produced during the healing of injured tendons. There is a major relationship between the obesity and the musculoskeletal disease. As we are aware, there is sedentary surge, particularly during the lockdown period. And this sedentary surge, the sedentary lifestyle, and this behavior has developed an unhealthy diet, unhealthy lifestyle, causing impact on weight, obesity, sudden rise of obesity, with a sharp decline on the musculoskeletal health. There is always the rise of obesity causes reduction of the musculoskeletal health, increasing all these problems, causing more back pain, neck pain, joints problem, and there is a great risk factor for cardiovascular as well as neurodegenerative disorders, which further complicate the management of musculoskeletal diseases. Obesity is an important comorbidity of many musculoskeletal conditions and is closely related to the development of osteoarthritis, which is one of the commonest musculoskeletal health issue. Thus, our strategies should we aim at reducing the obesity in adult with reduce the occurrence of osteoarthritis, can elevate some of the painful conditions. Interestingly, obesity is one of the most modifiable risk factor for osteoarthritis, and exercise and weight loss have benefited overweight and obese individuals with a knee osteoarthritis in many clinical trials. Thus, combining modest weight loss with moderate exercise can provide a best overall improvement in symptoms of the pain and joint malfunction. We can see there is a lot of consequences of childhood obesity and physical activity. The child in recent era, we can see there is a lot of increase in the childhood obesity because of lack of physical exercise in the childhoods. And these further leads to the musculoskeletal pain and other musculoskeletal deformities and impairments. Thus, reducing obesity in the children by encouraging physical activity will also reduce the risk of developing musculoskeletal pain during their latter life. As the sedentary lifestyle has increased since we are in the lockdown for last 2 years, many activities are happening as a online activity. There is a lot of reduction of physical activity among children, which is causing obesity among the children. Consumption of unhealthy diet, sedentary lifestyle, and all these simultaneously associated with increase in childhood obesity. Low in nutrition value and high in the calorific content food like pizza, burger, all the junk food contributes to the obesity, which also plays a role in high prevalence of type 2 diabetes and other cardiovascular diseases, which further exacerbated by the lack of fitness and inactivity. There is a correlation between the diet, a lifestyle on musculoskeletal health. Diet is definitely an important part in the healthy individual's musculoskeletal system. There is a study on which continuous 3-year follow-up, including 400 adults with a diet with high potassium, with fruits and vegetable intake, has been shown that there is a significant reduce in the amount of muscle loss with individual more than 65 years. A dietary flavonoid intake from the fruits and vegetables is also known to be a positively correlated with a good bone health, increased bone mineral density, BMD, and reducing the bone resorption in mainly the perimenopausal woman. Improving in the diet of osteoarthritic patient, knee pain have also shown a greater benefit. Vitamin D supplement, calcium, and particularly the protein consumption have been shown to optimize muscles, bone, and increase the functional outcome in older people with a reduction in the fall and fracture cases. Calcium and protein synergistically optimizes the bone health. We all know that vitamin D and calcium is mainly important for the musculoskeletal system, the muscles and the bone, but protein also plays a significantly important role of maintaining a good musculoskeletal condition. Dietary strategy is improving musculoskeletal health should include consumption of long chain fatty acid, vitamin D, vitamin K, which helps in the bone and cartilage mineralization and decreasing the blood cholesterol level. Various antioxidant rich diet may benefit the athlete by improving the tissue repair. Sarcopenia in elderly people can be benefited by combining exercise with a dietary supplements of whey protein fortified with vitamin D, as it increases the muscle mass and strength. So there is a significant role of diet on the musculoskeletal health. Just to summarize the entire topic in few words, we can see that avoiding sedentary lifestyle, improving a active lifestyle, doing minimally 20 minutes of exercise 3 times a week has causes and tremendous increase in good musculoskeletal structure. We have seen that active lifestyle with exercise, as per WHO, as per World Health Organization recommendation, which includes only 20 minutes of exercise 3 times a week, can cause a tremendous increase of musculoskeletal health, which reduces the risk of osteoarthritis as well as imbalance falling activity in elderly individuals. And as we are all are aware that active lifestyle, active, a proper musculoskeletal system is very much beneficial for keeping every individual active, reducing the risk of osteoarthritis, as well as the reducing risk of other cardiovascular and neurodegenerative disorders. So everyone should adapt a good active physical activity. It is not only for the adults, but since the lockdown is happening for so many, for almost for a year and more, there is even a sedentary lifestyle is developing in the children, which causing the obesity among them. Obesity is directly associated with impaired musculoskeletal situations. Obesity, the obese child is always prone to develop for pain in the muscles, pain in the joint, and is prone to develop more heart problem, cardiovascular, as well as neurological problem. So, friends, it is always beneficial. Do some light activity. Along with light activity, do some walking, brisk walking, cycling. All these simple activity will improve your musculoskeletal systems to a great level. And this improved musculoskeletal system will prevent you from pain in your joint, pain in your back, pain in your neck. Thank you so much.